We're recording the meeting. Thank you, Glenn. It's for people who weren't able to join the call today. Thanks for joining us. So I'm going to take about 30-40 minutes to go over some of the highlights, some of the findings that relate specifically to PrEP from a study based in Ontario called ACB Service Providers, Perceptions and Understandings of Biomedical Aspects of HIV Prevention. And today, since we are the CAN-PrEP group, I'm going to focus on PrEP, but it's just a tiny portion of the findings about how ACB service providers are handling all the new biomedical information around HIV prevention. So I just wanted to thank my team, my research team that was working with me, Henry Leomba, Shen Ryan, Daryl Tan, Wangar Thoreau, Jelani Kerr, Carmen Logie, James Wilton, and we were funded by the CIHR Social Research Center in HIV Prevention at the University of Toronto, which funded the study from 2015 to 16. And most importantly, I'd like to thank the 14 service providers who participated in the interviews. They were very candid and gave me lots of great information. So just quickly to let you know, this is a community-based research project. We did it by telephone interview. These are all people who work in HIV prevention, specifically with African, Caribbean and Black communities, or ACB communities. All but 2 of the service providers are actual strategy workers in Ontario who work under the ACB strategy. The analysis was a collaborative analysis with myself and a couple team members. We've had a fairly rigorous knowledge translation and exchange phase of the study. We gave 2 workshops through ACHO. We're producing a fact sheet for Shabak. We're going to work on 2 journal articles and this webinar. And if you have any questions as I go, please use the chat box, which you'll see at the right bottom side of your, right bottom corner of your screen. Or you can just shout out. It's pretty informal. So what I want to talk about first is the potential value of PrEP as seen by the service providers. They discuss the benefits of PrEP for various people within the ACB community, including heterosexual women and men, serodiscordant heterosexual couples, as well as gay, bisexual, and other men who have sex with men. They discuss the benefits of PrEP in relation to condom fatigue and as a way to help reduce HIV-related stigma. So in terms of heterosexual couples, the service providers discussed how PrEP could benefit community members by decreasing barriers in relationships, increasing sexual freedom, and reducing fears around HIV. Several of the service providers noted that PrEP can help to open up conversations about sexual and reproductive health and HIV prevention within serodiscordant couples. These conversations are often difficult for ACB community members given the stigma around HIV, and they also noted that it was encouraging to be able to discuss HIV prevention in ways other than condom use. If they can bring the information into their own relationship, they can discuss the possibility of using PrEP as a prevention alternative. PrEP would be great for serodiscordant couples and open another avenue for discussion about what is happening in relationships without having to talk directly about the relationship. I think it's important that we're going to have PrEP important in serodiscordant relationships when one partner is afraid to talk about their status because of the repercussions on the relationship. PrEP provides a way to keep a relationship going and also prevent the spread of the virus. It provides a much more meaningful way of discussing relationships in the work that I do. Another population or subpopulation that was really highlighted by the service providers is the role of PrEP for women. Within the ACB community, I see it being valuable for sex workers and women in abusive sexual relationships who may not know the status of their sexual partner and don't have the autonomy to negotiate safer sex. In my community, women would benefit because they are the bottom. They are the ones that receive whatever. If they're well protected, sometimes they want to protect themselves, and sometimes they might want to protect their partner. So as we can see here, service providers reflect on the potential value for women. They describe how women could especially benefit from PrEP and how this intersects with family planning and conception, issues around power and autonomy, and control in relationships. Some pointed out the value in providing women with a prevention option that they could choose and control for themselves. But they also pointed out that women are more likely to have more barriers to accessing PrEP due to issues of poverty, domestic and sexual violence, and less gender-based autonomy for their sexual health. Awareness and dialogue about PrEP is much higher within the gay community, as we all know. But ACB gay men may not necessarily be as familiar or comfortable with PrEP as their white counterparts. One of the service providers noted the value of PrEP to provide prevention backup in sexual practices that may present HIV risk. PrEP can open up conversations about sexual risk or can provide protection when conversations can't or don't occur within sexual encounters. There's a lot of misconception about how one can become infected, so PrEP is really helpful, especially for younger men who are too scared to even have a conversation before engaging in sex about the type of sex they want to have. It can help a great deal in easing the number of seroconversions among gay men. Stigma reduction came up as well, the potential of PrEP to reduce the stigma. They noted that PrEP can have the benefit of reducing fear and the stigma around HIV and reduce stigma targeted to people living with HIV. The logic goes, if people who are HIV negative are taking primary responsibility for HIV prevention, this reduces some of the burden on people living with HIV and reduces fear around having sex with people living with HIV. PrEP helps to reduce stigma. It's one of the great prevention tools that helps to reduce stigma. If everyone is protected, then I don't have to worry about criminalization anymore. I don't have to worry about people being in jail because they didn't disclose. And I don't have to hide myself because I'm HIV positive. If everyone is protected, it takes the burden off of PHAs. As an alternative to condoms, so obviously service providers understood the value of PrEP in providing a reliable prevention option other than condoms. My community has a hard time using condoms. That's just the reality. Even if we don't want to talk about it, that's the reality. Maybe PrEP can be the answer if it's affordable and accessible for everyone. Maybe that will be the answer. Because at the end of the day, well before we started talking about PrEP, there's condom fatigue. Okay, so those were some of the positive aspects of PrEP that the service providers talked about. As you would guess, they also raised several concerns that they have about PrEP, concerns that they anticipate from their ACB community members. These concerns include homophobic associations of PrEP, risk compensation, low community preparedness, side effects, viral resistance, distributive justice, and unnecessarily taking medications. So I'll go over some of those things with you now. Homophobia. So this is an interesting one that came up. In Canada, we know that the early uptakers of PrEP have been white gay men, and there's been significant buzz among gay men, especially in the big cities of Vancouver, Toronto, and Montreal. But unfortunately, this has had the unintended effect of bringing at least some people to have homophobic associations with PrEP. They associate PrEP with gay men and their promiscuity, and PrEP is not common conversation outside of gay communities and HIV organizations. It's a gay drug, essentially. It was noted that ACB community members who have heard about PrEP probably have heard about it in association with gay men. One of the challenges is that for those who are familiar with PrEP, accessibility issue aside, PrEP is increasingly associated with MSM, which in itself carries a stigma that may make it less attractive for heterosexual community members. It's associated with some judgment and stereotypes around promiscuity and the same stereotypes that circulate around homosexuality and homophobia that's long been associated with HIV in this part of the world. Because PrEP has been taken up so readily by the gay population, it becomes blocked as an option for prevention in the ACB community. PrEP is a gay man's drug. Community readiness. So many of the service providers express concern that ACB communities are simply not ready for biomedical prevention approaches such as PrEP. They express concern about the lack of education and awareness around what PrEP is and how it works. And ACB community members were seen by several of the service providers as quote-unquote just not ready and lacking the capacity to understand and use biomedical prevention tools. For some community members, they thought that PrEP would be a preposterous idea. The challenge in the ACB community is that the basic HIV education is not there. It's like we're jumping ahead before getting the basics down. I can sit here in the region and talk about PrEP, but if people don't even know how to access free condoms or navigate a sexual relationship, they're not going to be able to effectively negotiate or advocate access to PrEP. Without all that in place first, talking about PrEP is useless. So here we see a service provider who kind of thinks that the basics are the prerequisite before we talk about PrEP. PrEP is probably years down the line. Some of the basic discussions aren't even happening. A few of the service providers did note, however, that there can be a positive feedback loop. Interest in and use of PrEP will be higher if people are more aware of it as a possibility. Of course, gender issues come up. A few of the service providers noted that there are lots of concerns in relation to gender inequities and the social, economic, and relationship challenges that women may have in accessing PrEP. PrEP would be something that could possibly keep a woman safe if she does not know the status of her partner or can't negotiate condom use. This scenario plays out very often in the ACB community. There's a lot of sexual violence and unhealthy relationships, especially around economic dependency, especially when we're looking at newcomers. It's usually the women who are the caregivers and usually the ones who are very, very marginalized in our society. You're also looking at language barriers. A lot of the women don't have any power to negotiate unless their spouse says, yes, you can go to school to learn English. So accessing something like PrEP seems like light years away. One of the service providers also made an important observation that in the case of HIV-positive women in a serodiscordant relationship, getting a male partner to take PrEP could be a real challenge. So the concept of risk compensation and reduced condom use came up quite a bit. Several of the service providers voiced concerns that if we're promoting PrEP, we're going to have decreased condom use. Risk compensation was a myth, I would say, commonly held by the service providers. Promotion of PrEP was often conflated with reduced condom use. And if we think about it, fearing reduced condom use is a bit of a red herring in that PrEP is a prevention option for individuals who are already either unable or unwilling to use condoms consistently. One of the service providers felt that condom messages need to be fully taken up before PrEP should be promoted. Another felt that PrEP should only be discussed in conjunction with condom promotion, as PrEP is not 100% protective or is not protective against STIs other than HIV. The fact that PrEP is not, quote-unquote, 100% protective against HIV was also raised, which neglects to recognize that neither are condoms 100% protective. Many of the service providers are still using language that equates protected/safe sex as sex with condoms, and condomless sex as unprotected/unsafe sex. PrEP is one pill a day, brings a sense of invincibility, like I have nothing to worry about and I've forgotten all the basics. What I can see, and I've seen this in other health issues, if I'm going to be talking to the ACB community about PrEP, how will it reduce HIV infection? It will be misinterpreted as promoting condomless sex. PrEP is not 100% safe. There's still a chance that you can get HIV. We're not saying take your pills and you're home free. and you still need to use condoms because there are other STIs that you can catch from sex. So these are pretty common sentiments. There were also some of the service providers who pointed out that the message is confusing around condoms. The message that you still have to use condoms if you're on PrEP does not make sense to community members and can create a lot of confusion and or alienation. If you're talking to me about PrEP as a very good prevention tool, well, why are you still wanting me to use condoms? I want to choose PrEP instead of condoms, not use both at the same time. Your message as service providers is that they're both effective prevention tools, so why are you telling me to use both? And then other concerns that I won't go over in a lot of detail, but you're all quite familiar with, is concerns around adherence and drug resistance. The drug resistance one is one that is often overinflated and misconstrued. People don't really understand the concept of drug resistance and the fact that you only become resistant if you're HIV positive. It's not your body that's resistant, it's the virus. So I think we have a lot of work to do clearing that concept up. Accessibility and availability, of course, is a moving target now that Truvada has been approved by Health Canada. These are systems level issues that need to be worked out province by province. Same thing with the cost of PrEP. So I won't go over that in a lot more detail. Okay, so next I want to talk to you about some of the values conflicts around PrEP. There were many interesting values-driven sources of ambiguity around PrEP, as expressed by the service providers. So one of the issues that came up was equity in access to PrEP information. From the lens of equity, PrEP awareness and rollout should focus on the populations most impacted, but also people at high risk. So people like MSM are some of the most impacted, but there's also subgroups of the ACB community who might have lower rates than MSM, but are at high risk of infection due to vulnerabilities such as poverty, sexism, limited social capital, that makes them less able to avoid unprotected sex. Several of the service providers noted the inequity in the level of information made available to ACB communities, and thus in the uptake of PrEP as a prevention option. Many women are also asking me about PrEP. What about us? There's nothing for us. It's another discrimination thing. I hear that a lot. Women are one of the most vulnerable populations, so why not apply PrEP to women as well? If there's a new prevention tool, it should be made available to everybody. To say that the ACB community is not ready to learn about technologies like PrEP, I think in a sense that's a cop-out. Bring the people the information. Whether they're going to use it or not, at least they've had the information. They've heard it, and after that, it's individual choice. We cannot act as gatekeepers and prevent people from having that information. So for some service providers, it was clearly a strong issue of equity. Not surprisingly, we heard some of the service providers applying judgment on people who might choose to use PrEP. I'll just read the quotes first. What I've heard recently around PrEP, for the ones who are aware of PrEP, they see it as protecting for everything, anything and everything out there. Once you take it, you're fully protected and you can have any amount of sex. I can do anyone I want and I'm fully protected. Most of them are having risky sex with substance use involved. They can fuck anyone they want to fuck. I'm worried about whether we're trying to change people's behavior or just trying to find an easy solution for people. If you don't want to worry about changing behavior, then you just hand them some pill. So these quotes are just two examples of some of the judgments that service providers voiced in relation to those who might choose to use PrEP. There were a few service providers who felt that PrEP was a way to avoid quote-unquote behavior change, which equate condom use, but not the use of PrEP, as a behavior change. They also felt that PrEP is a shortcut or an easy fix, neglecting to recognize that PrEP uses much more than just simply taking a pill. It involves, as you know, frequent physician visits for STI, HIV, hepatitis testing, renal function testing, etc. The underlying value is that condom use is on a higher moral plane than PrEP use, and that those who would choose to use PrEP are more promiscuous and or less responsible than those who use condoms. several of the service providers noted that there are ACB community members living with HIV who have difficulty covering the cost of treatment or their drug plan deductibles, and therefore any public funding should prioritize HIV medication for those already living with HIV versus covering the cost of PrEP for those who aren't infected. I have issues with PrEP because I'm working with some members of the community who don't have enough financial resources to pay the deductible for their HIV medication. For me, that's the people who are in most need of the medication. It's a moral issue for me. The priority is for PHAs to have treatment first. Whatever funding or resources are left would go to people who are negative. Giving antiretrovirals for prevention purpose doesn't make sense if people don't even have them for treatment. Okay, so there was a lot there, and I'm hoping it'll generate some good discussion. I guess my take-home message from the study, and like I said, it was much bigger than just talking about PrEP, but biomedical approaches to prevention are introduced into a social context that is already full of challenges for ACB community members and their service providers. Concepts and tools such as PrEP and undetectable viral load have reciprocal interactions with health systems, with community understandings of safe sex, HIV stigma, homophobia, moralism about sexual behavior, and health literacy disparities in ways that can't be easily predicted. PrEP has the capacity simultaneously to increase judgment and stigma about sexual behavior and to decrease fear and stigma in sexual encounters. So service providers were asked primarily about their perceptions of what ACB community members are saying about these new prevention technologies. But I would say that their responses were often a proxy for their own personal perceptions, knowledge, and attitudes towards these technologies. Their own value systems were very evident throughout the interviews, and it's easy to recognize the ways in which their interpretations and perceptions shape the information that they would then provide to ACB community members. Sharing information about PrEP, for example, is not a straightforward transmission of facts. It's constantly nuanced by social contextual factors of stigma, socioeconomic considerations of access and affordability, alliance or contradiction to condom use messages, and implications for interpersonal relationships. It's also pretty evident through the interviews that there are still some misconceptions around biomedical concepts, in particular overinflated concerns around drug resistance, less than perfect, less than 100% protection, risk compensation and reduced condom use, side effects, and STIs. Many of the service providers felt overall fairly confident in their knowledge and of the biomedical aspects of HIV, but others were quick to admit that they needed more training. Most of the service providers were also quite willing to admit that they could use additional training and resources on how to translate these biomedical concepts into ways that could be accepted and understood by ACB community members. So overall, raising awareness and uptake of PrEP is a challenging endeavor in this overarching environment of stigma, lack of basic HIV awareness, and HIV criminalization. However, many service providers felt strongly that providing information, especially about PrEP, is a matter of equity, and they felt that ACB community members should have access to comprehensive and updated prevention information, and that it should be left up to individuals to decide if this information is relevant to them or not. So thanks for any comments you might have, any questions. I guess we have about 10 minutes, 13 minutes to open it up to conversation. So you can use your phone line. If you're muted, *6 will unmute you. Any questions or comments? Any surprises in the data that I presented?
Thanks, Ann. It's Glenn here. It comes through loud and clear that some of the service providers see like the sort of right to information as being crucial and central, that from the HIV 101 through the more complex onto PrEP. Did they talk about who they thought was the most appropriate person or agency or intermediary to deliver that information to the ACB community?
Well, given that 12 out of 14 people I talked to were ACB strategy workers, I think they saw themselves as best placed. They are from the communities themselves. They're all themselves people from African, Caribbean, or Black communities, and they know their communities very well. They did acknowledge that it's difficult to attract community members to HIV workshops, so they, best practice within the community is to work through existing cultural and social events and venues and organizations kind of around, working around that it's an HIV-focused education session and framing things instead in terms of relationships or dating or, trying not to be so direct about the HIV education. But I think they saw themselves as best placed as long as they provided the workshops in ways that were non-threatening and not necessarily labeled as an HIV workshop. But there's others on the call who might be able to answer that better.
There's some chat going in the chat room as well, if people want to take a look on the bottom right-hand corner of your screen.
I can't actually see the chat, which is kind of annoying. Oh, here we go. Okay, sorry, I just had it.
San, it's Ron.
Hi, Ron.
Did you get a sense from any of the people you interviewed what their thinking might be around? We heard a lot, and not surprisingly, about the amount of what I would call community education or patient education. We didn't hear very much about provider education. I wondered if you heard anything through the through the survey about what people in ACB communities thought about who should be in a position to prescribe and what they need to know in order for them to be able to offer it to people that they are caring for who are members of the ACB community.
Yeah, that's a good question, Ron. It didn't come up a heck of a lot, to be honest. They didn't talk much about physicians because they really first saw the first step of information as missing, which is like the community level awareness that these things even exist. So before people know to even approach a service provider for a prescription, they need to know that, one, they're at risk and could benefit from PrEP, and then how to actually access that. Just by doing the interviews, it was quite evident there was a real range of knowledge within the 14 service providers, and familiarity and comfort with talking about some of these biomedical tools. Some were at very advanced and very educated and were able to talk at length about it, and others were clearly quite rudimentary in their knowledge and still getting familiar with it. So as the first level of information, of course ACB strategy workers are not the only source of information, but at that level, there was real variation.
Regardless of whether or not it, has come up at this point, I do think that it's something we need to really be thinking about in terms of who we educate to be in a position to prescribe to ethno-racial communities, including ACB, because, it's to my mind, it's going to be a very important component.
Absolutely. I agree. And, the ACB community members aren't necessarily going to specific physicians that target only ACB community members. So it's just the same group of frontline prescribers that need to be educated. And you know, a lot of these service providers are outside GTA, so have even less access to the information, they're less immersed in some of the PrEP dialogue. David had a question. He wanted to know whether the people interviewed were all community organization staff. Yes, they were, David. There were no clinicians or doctors. They were all ACB strategy workers, which is the ACHO strategy funded by the AIDS Bureau, the provincial strategy that focuses on ACB people. And then there were a couple service providers who were either former ACB strategy workers or worked predominantly with ACB communities, but not under that title.
Hey Sam, it's Molly,
Hi, Molly
from Women HIV/AIDS Initiative. Thanks so much for that. I missed the very beginning, so sorry if my question was covered, but I'm going to ask it anyway. I'm just, I think it's really important, the piece around, you know, not everyone has access to treatment, so why are we talking about prevention? And I'm just wondering, for one, if people talked at all about balancing those and the importance of moving forward and doing work on both of those fronts, and instead of prioritizing one over the other. And the other piece I'm just wondering about is the piece that I hear a lot is, you know, the stuff around we need more education. Communities are not prepared. We're not knowledgeable about it. We don't understand PrEP enough. And I'm wondering if people had any input into what helps, because I think the information is there. It's just like, you know, it's a new piece, and I really appreciated the comment about the more uptake happens, the more people will be familiar, awareness will raise, et cetera. So it's sort of a cycle. But I'm wondering if people had any sense of like where people felt more knowledgeable about it and how to do that. So how we can support our communities to build knowledge and feel more confident in their knowledge base and ability to facilitate conversations and build awareness about PrEP. So 2 questions.
Okay, thanks, Molly. Yeah, in terms of access to treatment as a priority, when people raise this as an issue, they often saw them as a dyad, and they saw it as an unjust way to spend public dollars. Many of the people who had few themselves come from African countries, were born in African countries where access is still an issue, and they just generally felt very uncomfortable with the idea that public dollars would be going to buy antiretrovirals for people who, quote unquote, don't even need it. So unfortunately, I didn't hear a lot of the people who raised this as an issue. I didn't hear a lot of balance in that response. They mostly just saw it as a ridiculous prioritization. And that is I think that's an issue we should, like, you know, confront and contend with and actually address, because I think it's a logical and an important view, given the context that many of these community members and their service providers are coming from. In terms of PrEP information, many of them said, until I'm 100% comfortable with the information myself, I'm not going to feel comfortable passing it on to my community members. And I think that's the same whether you're working with gay men or Indigenous people or injection drug users. As service providers, I think we feel a little nervous about passing information on until we're super comfortable with it. So, you know, some of the things that really help are putting the information in layperson language, as simple as possible, plain language. One of the service providers noted that a lot of really great information comes out from the national organizations, such as CADI and CTAC, but they're targeted to service providers who have a certain level of knowledge or have a certain level of fluency or literacy around HIV, but there's very few plain language layperson resources directly for the community. So that's something that they requested that we work on.
Mm-hmm. Okay. Stan, was there any conversation about drug use in communities and some of the resistance, for example, that was articulated in the INPED article?
No, drug use did not come up at all. It was discussed primarily or only around sexual exposure.
Mm-hmm. A lot of these statements are echoed in the International Network of People Who Use Drugs position statement that was put out.
Oh, yeah. How so?
Just in the piece sort of around, first of all, access to, and you know, a lot of people don't have access to harm reduction equipment and supplies and support. And then also the piece around changing behaviors and what are we focusing on. We haven't put, sometimes the funding and the support of harm reduction is limited, and therefore it's questionable if we should be like investing a bunch of money into the treatment of prevention when we're not doing a good job of a number of other things.
Yeah, that's a pretty valid point. Thanks. Any other comments or questions?
I'd like to make one more comment, Ron.
Sure, Ron.
Just about the need for, I think your survey is a really important baseline. And I know that there was, as you're probably well aware, a recent meeting to set a research agenda for PrEP. And while I would not, anticipate that this would have come up during the survey, I do think it's worth noting how important it will be to track changes in attitudes as we go forward that lead to changes in uptake. All of this being premised, of course, on equality of access. Should we be, let me say it differently. Let me say when we are successful in achieving an open listing on provincial formularies. So as we improve access to PrEP, I think it's going to be really important to continue to do these surveys on an ongoing basis to see how attitudes are changing and to see how that impacts, in fact, on uptake and in which populations.
Yeah, it's a really good point because at this juncture, it's kind of a moot point because the service providers, rightly indicated that all of this discussion is useless when it's really out of the reach in terms of affordability for many of our community members. So they're loath to promote and raise awareness about something that's not accessible. And so hopefully, that feedback loop will happen as access improves, as affordability improves, and use increases, awareness will go up and vice versa. Yeah, but I think it's an interesting, just from a social science perspective, it's really interesting to hear the discourse and how it is different among, within the gay community and gay service providers, the different levels of optimism and pessimism. And, some of the ACB service providers were quite rightly pissed off, that they felt like they've been left behind in some of these discussions or not engaged as fully. Of course, it's, up to them as well to engage themselves. But, there's definitely a two-way street there. We need to make sure that in anything we're talking about in terms of PrEP, that we don't hone in just on gay men, but that we try to take into account all the other perspectives, all the other challenges that other vulnerable populations might have with PrEP.
I agree with you completely, but by the same token, as we do the required education, I found, the arguments that some people raise, which I would call either-or arguments around funding for prevention versus treatment, to basically be a false dichotomy that, again, we need to do a proper job of educating people on basically sort of how the system works, because I think, if we draw proper comparisons to other harm reduction or technologies or provision of risk-reducing supplies, or we position it like birth control, and we're able to show the cost effectiveness of preventing infections, that the last thing we want to be doing is perpetuating what I described as a false dichotomy.
Absolutely. I think you're right. It is a false dichotomy. And so, yeah, there's a lot of work around that, and the messaging that, wouldn't necessarily be raised among gay men. So we just need to pay attention to that. I think it's 3:45 Toronto time, so let's pass it over to Glenn if there's no other burning comments about the study. Thank you, everyone, for the time and the space. And Glenn, you want to do the conversation about the Gilead meeting now?